By tissue tracking QA function, the ultrasound system will scan each pixel position by frame within the cardiac cycle, and then use region matching method and autocorrelation searching method to trace each spot and calculate the movement so as to determine myocardial motion more quantitatively. First, connect the ECG lead wire and obtain the ECG signal. Scan the heart and obtain a sign format file, which contains more than one cardiac cycle with ECG signal. We should select a high-quality video, which is conducive to ensuring the quality of tracking analysis. Select TTQA to activate the function. You can determine the image of interest by previewing the image. Use the trackball to select one frame image with good image quality. Select Cursor to obtain the cursor for endocardial tracing. Enter multiple points, at least 6 points. For the long axis section, accept the manual method. You can also use the 3-point method. After reference points are settled, double-click Set, and the system will display the boundary of the endocardium and epicardium. Rotate thickness to adjust the myocardial thickness, or put the cursor at the reference point where you want to adjust. The system will display a square cursor. You can move the square to the appropriate position with the trackball. Rotate the angle button to match the clinical image with the section icon. If the traced result is poor, select Reload to retrace the reference points or make adjustments to the points with the cursor. Select Tracking Cycles. When the adjustment item is 1, display the previous cardiac cycle image. When the adjustment item of tracking cycles is 3, 3 cardiac cycles will be displayed at the same time. Select Start Tracking to start the tracking function. Use Display Effect to turn on/off the vector arrow graphical display. The vector arrows represent the direction and relative velocity of the myocardial motion. Use Velocity Scale can adjust the scale length of the velocity. Display Style can adjust to display the endometrial, the epicardium myocardial, or all. After the parameters are adjusted, select the Accept and Compute button, and the system calculates the tracking results. It will display the curve. You can adjust the relevant parameters as needed. Short axis parameters include radial strain rate, circumferential strain, circumferential strain rate, circumferential rotation rate, radial strain, displacement, velocity, and area. The system provides left ventricular torsion data based on short axis sections of short axis view of apex and short axis view of mitral valve. Torsion is acquired by calculating the difference between the apex and base of the heart. Torsion equals to the rotation of the apex section minus the rotation of the mitral valve section. The x-axis represents time. The y-axis represents torsion by the time, degrees. After tracking, select Bullseye. The system can display Bullseye graph so as to evaluate the reverse motion of the myocardium. You can acquire the time to peak value of 17 segments, as well as the measurement result of EDV, ESV, EF, TPSD. Use parameter to see different bullseye graphs. Select Data Export to export analysis data of each segment in CSV format. Click Exit to exit TTQA.